Hello, everyone. Thank you for joining us today. We have today another lecture in our radiology series, and we are very happy to have Dr. Hamza today to present us the MRI lecture in the radiology series. And if you have any questions, please write them in the chat, as this platform doesn't allow you to speak, but you can write them in the chat and Dr. Hamza will later answer them. So thank you for joining, and I'll let Dr. Hamza have the stage and you can begin the presentation. Thank you so much for joining us today.
Thank you very much, Yael. Really appreciate your introduction, and welcome everyone who's here. I'm just going to share my presentation with you guys. Okay. Perfect. Amazing. So just a heads up from everyone who's here. Can you guys see the presentation?
Yeah, we can see it. It's perfect.
Amazing. Perfect. Thank you so much. So thank you. So as Yael said, my name is Hamza. I'm a junior doctor and I work in London or South London, in specific Croydon. For those of you who are familiar with London. And it's a pleasure to be here as always. I graduated from the Czech Republic in 2020. I studied in Olomouc at Palacký University. So I'm very impressed by the UIMS team in particular. They're honestly amazing people. So well done to all of you guys for organizing all of this for me and my colleagues presenting this series. So today we're going to be focusing on MRI scan, and we're going to be looking at some of the basic principles to understand MRI scans. Any questions, please feel free to ask, and I will try to answer them to the best of my knowledge. You've already come across some imaging modalities, including CT scans and X-rays that we've talked about in the past. MRI scans work on a completely different basis. And I think for our level, your level as medical students, and also for most junior doctors, if you are interested in radiology, you can always go into a little bit more detail than what we're going to go through today. But today is going to be a very brief, basic, but important presentation on the most fundamental principles of understanding how the MRI scan works and how images are produced. So once again, I'd like to say many thanks to UIMS Czech Republic, Emergency Society of Pleven University, who have also put in lots of effort in to creating this program, and also to my colleagues who are in this program with me and also presenters. So Dr. Tiju Zachariah and Dr. Karthik Rajagopal from Croydon University Hospital. And our very own consultant radiologist, Dr. Paramisparan, who is overseeing the whole series. So thank you very much to all of you. So the key objective, as I said, is to learn the basic principles of MRI imaging. We are not clinical radiologists, so if you have any questions, we'll try to answer them as well as possible. And also, we will try to make it as fun as possible for you, okay? But if you do want to go into more detail, I'm more than happy to provide you some resources or even some good places you can check out. And any questions that you have, I will be happy to help. So a small overview of this presentation is we're going to go over some basic physics. This will be great for those of you who enjoyed physics at school, I guess. You don't really cover much physics in medical school, not that I remember anyway. But if you like it, that's great. If you don't like it, you might not like this topic as much. But I think it's important to have a good overview of the physics background for MRI scans, because without understanding what's actually happening, you won't really understand the basic principles like T1 and T2 imaging. So it's important to go over the basic physics. That leads us on to the next point, which is the different types of sequences or imaging that we have in MRI. So T1, T2, we're going to talk a little bit about flare and what flare is and contrast. And finally, we're going to be looking quite a lot at the brain. That's probably the most common type of MRI scan that you will come across, but you may come across other types during your medical school career, for example, soft tissue imaging, musculoskeletal imaging, MRI in the context of MRCP, or magnetic resonance cholangiomagnetography. So there are lots of different uses for the MRI, but we're going to be looking at the brain in particular for today. So we're going to talk a little bit about the key terminology. Now, as I said before, X-rays and CT scans, we talked a little bit about the terminology we used there was opacities or lucency in terms of X-rays, or in the case of CT scans, density. Okay, but when we talk about MRI scans, we talk about intensity of the signal, so hyperintense and hypointense, and that is comparing the different body tissues together. Okay, so we'll go into the imaging in a little bit more detail later on, but essentially we have an image there just to illustrate this particular concept. In the first image, what appears brighter, what the arrow is showing essentially in the brain or cerebral tissue, is a hyper intense signal. Okay, and the reason why I say it's hyper intense is because it presents as brighter than the surrounding tissues. All right. In comparison, in the second image, you can see that actually in the same area, there may be some darker type of tissue, and we refer to that as hypo-intense signal. All right. Now, the intensity of the signal coming from a specific tissue varies on a number of different things. It varies on the composition of that type of tissue, the age of that type of tissue, and also that is important in identifying things like specific pathologies. Okay, so if you're looking for specific pathologies and you want to differentiate between different types of tissues, understanding the type of signal that's being given off is important. You can also use other techniques to enhance particular type of signals. Okay, but we'll talk about that a little bit later on. So the basic components of an MRI machine, for those of you who are here, does anybody know the function of any of those three particular components of the MRI machine? Okay, so we've got a couple of different types of components in the MRI machine. We've got a magnet, we've got different coils, and we've got a computer, or essentially a scanner, which is a part of the scanner, and they all work together to essentially produce an image. Okay, and that's your MRI image. Now, the basic principle of how an MRI machine works is essentially based on magnetic fields. Okay, and you're essentially creating an external magnetic field that will affect the body. We're going to talk a little bit about how that is in a minute. But in a nutshell, the body is made up of a lot of water. Roughly about 70% of the body is made up of water, and water contains both hydrogen and oxygen, as we know. The hydrogen aspect is essentially a proton, or H plus ion, essentially. Now, a magnetic field can affect that hydrogen ion by affecting the way it spins and also the way it aligns itself. Okay, so it will align essentially in the direction of that magnetic field. So the whole point of the magnet, which is point number 2, is essentially to create the magnetic field. We also have what's called a gradient, and the whole point of that gradient is to break that field into smaller parts which are focused on the body, or different parts of the body. And as we spoke, the magnetic field will affect the hydrogen protons all around the body. Next, we have what's called the radiofrequency coil, or the radiofrequency pulse. And we will talk about the effect of the radiofrequency pulse in the next couple of slides. But essentially, once again, it changes the way hydrogen protons act in the body. And once the hydrogen protons start to lose the effect of that radiofrequency pulse, we use those timings to determine what kind of image we're looking at. So if it's a T1 or T2 weighted image. But as I said, we'll come on to that in just a minute. And finally, the computer in the scanner essentially receives in the form of a current. It receives information, which it then turns into an image, and that is how we see the whole MRI image. Okay, so the main key concept in this particular slide is essentially that an externally applied magnetic field is created, and it affects the whole entire body, which consists of a lot of water. Okay. And we can measure the strength of that magnetic field. So usually the unit is Tesla, and it's usually between about 1.5 to 3 Teslas as being the strength of the magnetic field. So we spoke a little bit about this, magnetic fields and hydrogen nuclei. So in the first image, we can essentially see that the hydrogen nuclei are all moving in different directions. And the key term here is vector. There's no net vector or net magnetization in figure 1. They're all moving in different directions, in opposite directions and against each other as well. Whereas if you essentially expose them to an external magnetic field, most of them will align anyway with that magnetic field. As you can see, there's a couple of them pointing in the opposite direction, but most of them are pointing in the direction of the magnetic field. So what happens to the energy of that hydrogen ion? Does anybody know what we would refer to as a low energy state or a high energy state? So in terms of the first image, we would refer to that as a low energy state, okay? And the second image, we refer to that as a higher energy state. So when we expose hydrogen ions to a radio frequency pulse, it causes a particular effect on the hydrogen ions. Just to keep it simple, you'll see in this image here that there's different types of axes. You've got the z-axis and the xy plane, or the xy axes, all right? And we use this to demonstrate the effect of the radio frequency pulse on hydrogen ions. So when the field is external magnetic field is applied to the hydrogen ions, they will align across the z-axis in one particular direction, as you can see in figure 1. Once the radio frequency pulse is applied, which is in image 2, you can see that in image 3, the net magnetization changes to the xy plane. All right, so there's a movement of the net magnetization. Okay, we refer to that as in phase, and that's important to understand because over time, when there's no externally applied magnetic field or radio frequency pulse, the hydrogen ions start to lose their position in phase, and they go back to being out of phase. And that is a very specific time that that is important when looking at MRI scans. Okay. So the term that we use to this change in fields is usually called flipping of magnetization into the XY plane. Okay. So next we're going to talk about something called T1 relaxation time. And we talked in the previous slide about how it moves from the z-axis to the xy axis. And over time, this flips back to the z-axis. So if you want to think of it in the opposite direction to this arrow here, which is a curved arrow showing movement from the z to the xy, over time, that reverses and it goes back to the z-axis. And we say that that is transverse to longitudinal relaxation. So transverse to longitudinal. A bit like what this image is showing here, essentially. Okay, so if we focus on the red arrow, it's going from the XY plane to the Z plane. Now, this is an important time. Different tissues have different times, and we call this the T1 time, essentially, okay, to T1 relaxation time. And when we image tissues, they will present differently on T1 weighted images as a result of this particular time. And the two tissues or two types of um, matter that we look at essentially is water and fat. We're going to talk about how those present a bit later on, but they have different timings when it comes to T1 relaxation time, and therefore present quite differently. Okay. The second concept is when we look at T2 relaxation time, or T2 time essentially, and that's called the transverse relaxation. All right. So in the first image, if we focus on the white circle essentially, we can see a particular arrow pointing in a particular direction. And going back to the beginning when we talked about exposing hydrogen ions to an external magnetic field, and a radio frequency pulse, they align in a particular fashion and they precess, which means they rotate. But over time, they lose that. And what happens is they start to move around rather than being focused in one particular direction. And that's what you can see happening in the white circle as we go across in time. So this particular time is what we call transverse relaxation, and is important when we are looking at T2 time or T2 imaging essentially. So those are the basic concepts when it comes to T1 and T2 imaging. So to recap, T1 imaging essentially is transverse to longitudinal and the time that it takes for that to happen, whereas T2 is transverse relaxation time. So fat and water present differently in T1 images and T2 weighted images. And we're going to talk about a comparison of fat and water to other types of tissues coming up in just a minute. But essentially the key thing to note is that in T1 images, fat appears brighter than fluid or water essentially, as it has a higher intense signal or more intense signal essentially. Uh, and you can see from the graphs as well that basically fat has a shorter T1 time or T1 relaxation time and T2 time as well in comparison to water or fluid. The effect of this is different in both types of images. So in T1 weighted images, the fluid appears to be darker as compared to areas of fat, which appear to be brighter. But in T2 weighted images, the effect is quite the opposite. If you want to see things like cerebrospinal fluid or even sometimes acute bleeding or strokes, so you're looking at blood, for example, T2 weighted images would show the fluid or water being brighter than the surrounding fat, which is in the cerebrum or the brain tissue. So as I said, this is a comparison essentially of different types of tissue. So water has the longest time in T1 and T2 as compared to fat, which is significantly less, but the effect of them is slightly different essentially. You've got other types of tissue here as well. So muscle, liver, for example, which are greater than fat. And you've got particular types of proteins, for example, that will be a lot less. So the type of tissue you're imaging will have different timings when it comes to T1 and T2, and as a result will appear differently on the MRI scan. So we've got an example here just to show something different rather than the brain, but we're looking at the knee here essentially. So as I said, MRI scans can be used to image a lot of different types of body tissue, including musculoskeletal imaging. That we tend to do an ultrasound first and then progress to an MRI if need be. But MRI is quite commonly used when it comes to knee problems or even shoulder and joint problems. So in the first image, which is a T1 weighted image, you can see that the fluid in where the synovial capsule is and the joint essentially is black in comparison to the surrounding tissue, which is whiter, so fat is brighter than the surrounding fluid. But in the T2 weighted image, the fluid is basically brighter, and that's the same as we saw in this particular image of the brain, essentially. Okay, so most people explain that the brain tissue in comparison to fluid is brighter or darker, but it's important to understand what that actually means, because when you're comparing it to different types of tissues, then you'll be able to understand or differentiate between tissues a lot more easily and understand what's going on. When we talk about pathologies, generally the majority of pathologies have a high water content. So they will appear differently on T1 or T2 imaging. So in this particular case, we're looking at a tumor which is causing a bit of a mass effect and some surrounding edema. So as we said, the T1 weighted image, you can see the fluid is darker in comparison to the surrounding brain parenchyma or tissue, which is made up a lot of fat. And so it's darker and the brain parenchyma is whiter. But the surrounding edema around the tumor is also darker in comparison to the brain parenchyma, okay, which presents differently to T2, where the fat is darker, and you can see the surrounding cerebrospinal fluid, which is more white, and in the middle, in the ventricular area, is a lot more white, and similarly, the edema surrounding the tumor is a lot more whiter as well. So generally, if there's an abnormality in signals, and you're querying a pathology, most of the time there's a higher water content or fluid content, and it could be things like edema or even bleeding. So we're going to now talk a little bit about the particular sequences, different sequences and MRI scans that we can use to enhance particular features of the scan. So FLAIR MRI stands for Fluid Attenuated Inversion Recovery Time. It's quite a complex name, but essentially the whole point is to negate the signal from the free-flowing fluid, or in particular the CSF. So you can see in this particular case, the CSF is black. It's more hypointense compared to the brain tissue. Okay. And what are the particular examples that we can use this in? So there's a number of different reasons why we do FLAIR imaging. But commonly it's used for things like lesions. So if you want to classify the type of lesion you're looking at, whether it's cortical or subcortical, and we'll look at a couple of images later on as examples where FLAIR imaging has been used. And we'll talk a little bit about contrast in MRI. So previously we talked about contrast in CT scans. We talked about different types of contrast, including iodine. But in this particular case, when we use MRI, we use gadolinium. And once again, it's used to enhance particular features, which may not be very visible on non-contrast scans, essentially. You can see on this particular image of the brain that actually in the pre-contrast scan, there seems to be some kind of irregularity there, maybe a tiny bit of mass effect, if you want to call it that, but definitely some kind of abnormal signal. Post-contrast, there is enhancement of some irregular tissue there, or mass in this particular case, which could be a tumor, but given the clinical context of the situation, it can be diagnosed. And some post-contrast effects, it can cause headache, dizziness, nausea. Sometimes patients complain of flu-like symptoms. And they may also say that, for example, they feel like going to the toilet to pass urine, but there's various different ways that they can present after having gadolinium injection, which is intravenous. So now we're going to look at some examples of the MRI brain. So remember, when we're looking at imaging, there's different planes that we look at imaging in. We've got your axial, your coronal, and your sagittal. And that's very basic to understand when you're looking at any kind of image. It's very important to understand what plane you're looking at things in. Okay. And also to understand that the patient's left, maybe your right, and vice versa. Um, Everything in radiology is very anatomical, of course, so you've got to use the right terminology when describing that particular scan or looking at whatever you're looking at, essentially. So anterior, posterior. But the most important thing here is to know what side you're looking at, basically, and what plane. So once again, we're going to appreciate the differences between what T1 weighted images look like versus what T2 weighted images look like on a brain MRI. And we can see that there are very clear differences in the ventricular system, which contains the CSF, and also CSF surrounding the brain sulci are very hyper intense with a higher signal in T2 weighted imaging as compared to the T1 weighted imaging. And in the T1 weighted imaging, the brain tissue, which mainly consists of fat, has a higher intensity of signal as compared to T2 weighted imaging. And of course, you can go into more detail and talk a little bit more about the anatomy, but we're not going to focus on that just yet. I think the main point of this presentation is to identify and appreciate the key differences between the different types of sequences or scans that you can have in MRI. So it gives you beginners a foundation, essentially, to go from. We spoke about flare earlier on, and I just wanted to include this image to appreciate what it looks like in comparison to T1 and T2 imaging. So as I said, we essentially change the intensity of free-flowing fluid, or CSF, essentially. So you can see here, it's actually become very dark, or black, essentially, in this case, which is somewhat similar to the T1 imaging, and it looks a bit like a T1 imaging, but actually it's a flare sequence, essentially, in comparison to T2, which is hyper intense. And there are other types of sequences which include T2 star or DWI, for example, but they can be used to enhance things like blood on imaging, or even certain other pathologies like masses as well. So we're going to look through a couple of examples now, and let's see what you guys think. I think we've got 2 comments here. So can we touch on indications T1, T2? Yeah, sure, of course. Thank you very much. And the second question is there any degree of nephropathy below gadolinium contrast can be unsafe? Sure, thank you. Appreciate that. Yeah, so T1 and T2, and why we would use one over the other. So essentially, it depends on the type of tissue that we're looking at, and it depends on, for example, if we're trying to differentiate between different types of tissues. So in the case of T2, if you want to look for things like bleeds or fluid, T2 imaging may be better. Whereas if you're not querying, for example, potential bleed, so it really depends on the clinical scenario, essentially. But T2 imaging is better is better used when looking for pathologies that include things like bleeding, for example, or fluid, essentially. You can see a little bit more clearly on that. But actually, a lot of the time, they have both scans done, or even a flare scan in combination as well. So it really depends on the clinical indication and the presentation of the patient as well. And the second question is there any degree of nephropathy below which gadolinium contrast can be unsafe? So generally speaking, I think we have to check the renal function of the patient before administering gadolinium. I'm not too sure particularly about the degree of nephropathy that the gadolinium contrast may cause. But that's something that we can look into and let you know. But yeah, I think generally speaking, we have to look at the EGFR and the renal function or the renal panel of the patient before providing contrast. And if, for example, they are not able to have it for whatever reason, then maybe because of that. Okay, so we'll move on to the next slide. Okay, so right. So we've got a first pathology. So we've got an 85-year-old male, which presents with sudden right-sided blurry vision and headache, and he feels quite nauseous as well. He has a past medical history of atrial fibrillation, hypertension, and he's got large prostate, essentially. So he's come in. You've seen him in the emergency department. What other questions do you think you're going to ask him? Does he take any anticoagulants? Great, fine, fantastic. Good. So yeah, you can ask him about his pharmacological history. I think the key things to ask here is how sudden his symptoms have been, and also if he has any problems with his limbs or his neurological exam, essentially. Okay, because you might be thinking of a couple of things. And what are you thinking of when a patient presents like this? Yep, giant yell. Thank you. Stroke. Great, fantastic. So in terms of exams, we talked a little bit about what we'll do. So we do a basic neurological examination. Let's say he's had this nausea or blurry vision for a while, at least a couple of days. You can do, for example, the HINTS exam as well. That's that. And in terms of investigations, so you've done a CT head, for example, and there's a small pathology in the CT head, and you've spoken to a stroke specialist as to what that might be. So you've admitted him for an MRI scan, and this is what the images of the MRI scan look like. So let's talk about the first image on the left. Do we think that's a T2 weighted image or a T1 weighted image? What do we think? Okay, great. And why do we think that this is a T2 weighted image? What can you tell me about the what essentially enhances signal and what has a lower signal essentially? So the fluid in the ventricular areas that are higher signal or lower signal in comparison to the surrounding brain tissue. Yeah, hyperintense signals. Great, fantastic. So you can see at the bottom, towards the occipital area on the left side of the patient, that there's a small abnormality we're talking about here, essentially. Okay, and the second image is actually what we refer to as a DWI type of sequence. Okay, but it enhances that there's actually a little bit of blood. So this is an infarct or a bleeding essentially, and it's a stroke. Okay, so that's an acute stroke that we're looking at. And just to compare, so we have, in comparison to patients who have presented with previous strokes, you can see that actually previous strokes presents quite differently. So it's more hypo-intense in compared to the hyperintensity that we just saw. Right. So pathology 2, we've got a 30-year-old female with a 2-month history of confusion, memory loss, and headaches. Past medical history, she's got fibroids, she's got some ovarian cysts. What other questions would you ask? Okay, so she's presented with a bit of confusion, memory loss, headaches. What are the other causes? What could also cause these symptoms if we're not thinking about um, anything related to the brain, for example? So it could be endocrine related, it could be thyroid related, it could be a number of different things. It could be related to the menstrual cycle, for example. There could be a number of different causes for these symptoms. But because we're focusing on the brain at the moment, there's a particular diagnosis that she has. We're going to talk about that in a minute. Does anybody cerebral mets? Okay, yep. So there's one particular potential here. Any other guesses as to what might be causing it? Meningioma, great. Okay. So you do an examination and you find that she's actually presents with hyperreflexia, and she's got slightly abnormal, some cerebellar signs as well. What do you think might be going on here? So you do an MRI scan, and the MRI scan presents with these images. Okay, so you can see there's some lesions across not just the brain but the spine as well. Okay, so these particular areas of abnormality are actually multiple lesions in multiple sclerosis. Okay, so this is a patient who's presented with multiple sclerosis. And in this particular image, in the first one on the left side, this is a T2 image, and we're looking at a flare image on the right side. Okay, so enhancing the intensity of those particular lesions to see them a little bit more clearly. Finally, the third one. So we have a 56-year-old male, previous smoker, 6 months of night sweats, weight loss, now hemoptysis. He has a persistent headache. He's got a past medical history of COPD. You've done a basic X-ray, and on the X-ray you can see a small abnormality, and you think to yourself, what might this particular abnormality be? You do a CT thorax, and that CT thorax shows a very suspicious-looking mass. Um, what do you think might be going on as to why he's having his brain symptoms? I think we've already talked about this actually, but essentially we're looking at what what might be going on. Metastasis. So so this is a patient who may have a pulmonary or lung cancer essentially, and you do an MRI scan because he's presented with those headache symptoms, and you can see that there's some lesions here. Okay, and here are those lesions basically enhanced post contrast. Okay, so basically these could also be the tuberculosis could also present in a similar way, but in this particular case, these are metastasis from a lung primary, essentially, right? So, if you want to learn more about those particular topics that we've discussed, I would recommend checking two channels out on YouTube. So, Navigating Radiology, which I've used as well for this particular lecture, by Dr. Rajesh Banya, and also Leicester Medical School Radiology as well. They've got some nice videos on brain MRI. Radiopedia is a great website for those of you who are more interested. And then we've got some books as well if you want to have a look at them. But yeah, that brings us to the end of the lecture. I can see we've got a couple of questions here as well from Dr. Hey Daddy. So, oh wow. Lake Alien Hospital between active disease and chronic scarring, or is it better when coupled with PET scanning? To be very honest with you, I think a radiologist is probably in better position to answer those questions. But what I can say is when it comes to cardiac imaging, MRI imaging is very important, especially looking at things like atrial fibrillation, or, for example, cardiac scarring post myocardial infarction. So PET imaging, you don't really, I mean, that's more nuclear side of things, but PET imaging you don't really use unless you are thinking of, for example, tumors or things like that. So you can use them in specific cases. But in the case of cardiac history, a patient who has cardiac history, for example, I think that it's very specialized essentially. But MRI imaging in terms of context of the heart is usually used to look at things like scarring and fibrosis as a result of myocardial infarction. DWI. So DWI is a type of sequence essentially that can be used for enhancing particular features. So we talked about, I think, the previous slides. Just get back to some here. Um, Yeah. Yeah, so DWI can be used to basically enhance particular features like bleeding, for example, or even an acute stroke, as this in this particular case. So yeah, there are different types of sequences, but we can go into more detail in the next lecture if need be, if you guys are more interested. Thank you very much. Really appreciate it.
Thank you, Dr. Hamza. And if you don't mind, let's just wait like one more minute to see if there are more questions. And if not,
Sounds good.
of course, thank you so much for the amazing presentation
Thank
and
you.
for joining us today. Oh, I see there's a new. Oh, thank you. Okay,
Yes, thank you. Yes.
so that's perfect. So I think we can finish it off. Thank you very much again for joining and for the presentation, and have
Thank
a
you very
lovely
much.
evening.
Appreciate it.
Goodbye.